Good evening. My name is Ogun-Semore, and I'm going to talk about my clinical scholarly projects. My topic is on the use of non-pharmacological interventions, primarily using cognitive behavior therapy in treating dementia-related behavioral disturbances. The use of antipsychotics has always been the first-line therapy in treating dementia-related behavior problems. We know that most dementia patients do actually have some psychological diagnoses such as anxiety and depression. The only way reasonable to use antipsychotic will be if this patient have been diagnosed with some schizophrenia and bipolar disorders before the onset of the dementia. Dementia has a component of behavior such as agitation, anxiety, restlessness. This should not be considered a psychosis. It may present that way sometimes, but should not primarily be considered a psychosis. In considering this role and the importance of stakeholders in any clinical setting and in facilitating any beneficial projects such as this CSP, the project will work with two stakeholders. The first one that will be using primarily will be the administrator, and this person is definitely going to be the bridge, like the liaison between this clinician and the CEO and CFO who are going to be funding the project. So, and also I'm going to work with the director of nursing, who is going to be the person that is going to work directly in alliance with the clinical nursing and therapy staff to communicate the progress notes and improvements to family members. Maslow hierarchy of needs, when it's described as its hierarchy, the very first level of Maslow's need is the physiological human needs. When this is not met within an environment, there's always the need to seek and yearn for more. So once the basic need is met, there will be a level of comfort. There will be a level of reassurance to move on to the next level. Some of those dementia patients are they need to be interacted with. They need their needs to be met. Sometimes it could be pain. It could be that they needed to be talked to. They need interaction. They need to be changed when they're soiled. Well, the little things there, they just kind of want attention. And when somebody interacts with them, talk with them, and change them or meet the need, the physical and the physiological need of maybe it's as simple as addressing their pain, they kind of readjust to the situation, and the agitation, the restlessness, and the grimacing, and the girding, and the fighting kind of subsides. Roy's theoretical concept of adaptation promotes activities in the sedentary older adults who are already in a maladaptive state due to inactivity and not being able to regulate both their physiological, sociological, and physiological states of being. This is still in alliance with conceptually, it's still in alliance with the meeting human needs. Most of these elderly patients are already in a nursing home in an environment that's probably strange to them. They don't know what's going on. They have lost touch with reality. The environment is totally not has been maladapted. not to them. They don't understand the concept of being any longer. They're now constantly in struggle with what's changed with them, struggle with the environment, their cognitive behavior, with the application of cognitive behavior therapy, talking with those people and having the licensed therapists work with them. And the app that I'm actually going to use is the MindMate. MindMate has different activities that promotes cognitive enhancement and at the same time get them busy right after the physiological needs are met, such as when they've been trained, that they've been medicated, be pain wise, or they've been turned, they've been interacted with, and they're still kind of like still not resting or still not comfortable. This app kind of like help the patients to there's some part of the application that helps the patient to reminiscence about their past, simulation of environments where they grew, where they lived. It's not like a home setting. They can actually walk through this environment to appease their emotional needs at the time, and that way they can get comfortable. Intervention will assess the motivation behind this program and will be delivered working with licensed therapists. Yes, like I said, we're using the MindMate app, and also it is of importance to know that when human needs are not met, in individuals with dementia, they have reduced ability to think through stimuli. There's a decrease in the stress threshold, and frustration, agitation, anxiety, and restlessness increases. Thank you.